Assalamu alaikum. Today we are talking about hepatitis. What is hepatitis? Hepatitis is involve inflammation of liver cells and damage to the liver. The liver is essential for removing toxins from blood, storing vitamins, and producing hormones. However, hepatitis can disturb these processes. At least 5 viruses can lead to complication, sometimes life-threatening. These including A, B, C, D, and E. Other causes of hepatitis are cytomegalovirus, Epstein-Barr virus, and yellow fever. Regarding hepatitis A, the CDC estimated around 6,700 new cases per year in USA, but these became declined due to vaccination. Occur due to contamination of food and water, i.e. fecal-oral route is the main mode of transmission in hepatitis A. Symptoms include jaundice, abdominal pain, nausea, low appetite, flu-like illness. Some people not experience any symptoms at all, which usually recover within few weeks and they have immunity to it. Rarely it can be fatal, and most people recovered without any intervention. Regarding hepatitis B, it's usually acute and short-term, but can be chronic, especially in children. Long-term complications as liver cancer or cirrhosis can affect it 15 to 25%. The virus can be transmitted through unprotected sexual intercourse, sharing needle, tattooing, sharing toothbrush, razoring, breastfeeding, and transplacental in lady women. Symptoms same to other types of hepatitis, i.e. jaundice, abdominal pain, fever, flu-like illness, anorexia. Safe vaccine available that are protected. Treatment usually supportive and sometimes we need antiviral. Regarding hepatitis C, it is a blood-borne virus transmitted through sharing needles. So it is more common in healthcare workers and those who are at risk. It can short-term, but 85% of people develop chronic long-term infection. Person usually asymptomatic in 50%. Transmitted to the other without realizing, i.e. he have no sign and symptoms in half of cases patient with hepatitis C, and they transmit it to the others without realizing that they have a disease. Treatment needed in 25% to eliminate the virus within time. Other become chronic. According to the CDC, hepatitis C is not needed treated unless chronic and usually give combination of antiviral for 8 to 12 weeks. Regarding hepatitis D, it is usually co-infected with hepatitis B, so it does not occur alone and usually takes the characteristics of hepatitis B. It can be propagated in the presence of hepatitis B. Regarding hepatitis E, it can cause fulminant course, particularly in pregnant women, with a rate of 20%. Chronic infection usually occur in immune-compromised patients, and the mode of transmission usually like hepatitis A by fecal-oral transmission, and usually like hepatitis A is a self-limiting disease. Regarding symptoms of patients with hepatitis, many patients with hepatitis experience mild or no symptoms, i.e. asymptomatic. Acute hepatitis usually present as a mild flu, to fatigue, to pale stool, anorexia, fever, muscle and joint pain, abdominal pain, sometimes nausea and itchy skin. Acute phase is not dangerous, but chronic infection and liver complication can develop. Regarding the diagnosis of patient with hepatitis, how can we diagnose the patient? Of course, by history and physical examination. And we send for investigation. The important investigation we use in hepatitis is total serum bilirubin in both direct and indirect. And as you know, in hepatitis, the direct bilirubin is elevated much more than the indirect one, but also can be occur both as a direct and indirect elevation. Other tests can be used for diagnosis is liver function test. What I mean by liver function test? These are enzymes including ALT, AST, and alkaline phosphatase. In hepatitis, there is elevation in ALT and AST. Other tests can be used in patients with hepatitis, such as our example of autoimmune hepatitis. We can send for autoantibodies. Also, we have a PET reliable test and non-invasive one, which is ultrasound. It's very important in patients with jaundice as a whole, because it look for complications such as ascites, liver tumor, gallbladder abnormalities. And of course, liver biopsy as a last choice for investigation patient with hepatitis, because it is invasive and not every patient can accept this test, but it is most beneficial one and helpful in diagnosis. Regarding treatment, for hepatitis A and B, there is no specific treatment. Avoid alcohol and other toxins that's harmful for liver, especially paracetamol overdose. The body will recover anywhere from 3 to 6 months, usually without any permanent damage. For hepatitis C, there are several medications that can be prescribed for treatment. For more severe cases, as a liver transplant may be required. Chronic hepatitis may lead to progressive liver failure, including jaundice, swelling of lower extremities, confusion, dark urine, i.e. complication due to hepatitis, and these treated accordingly. Regarding prevention, a vaccine is available and is highly recommended for people who are in high-risk professional, such as healthcare worker. Always wash your hands after using the bathroom and before preparing food, especially in hepatitis A and E, because it's transmitted by fecal-oral route. Limit use of alcohol and drug toxin to the liver. Be aware of food preparation while traveling in other countries. Be alert when coming in contact with blood and other body fluid, especially in hepatitis C. This table showing the difference between the different type of hepatitis. As we know, the source of virus is feces in A and E, and blood and derived body fluid in B, C, D. Route of transmission is fecal-oral in A and E, and percutaneous and permucosal in B, C, D. Chronicity can be seen in B, C, D, but not in A and E. And we can prevent the patient with A and E by pre- and post-exposure immunization and ensure drinking water. And B, C, D, usually pre and post exposure also immunization with behavior modification. Also, there is a difference by type of virus. It is DNA in B and D, and RNA in A and C. Regarding complication of hepatitis, you know, B and C can lead to chronicity, chronic liver disease, and this is lead to liver cirrhosis, and sometimes in long periods it can develop hepatocellular cancer. And in patients with a chronic liver disease may develop hepatic encephalopathy due to ammonia overprotection and affected on brain and consciousness. Sometimes kidney failure also as a complication of hepatitis, as a complication of hepatorenal shutdown that occur in chronic liver disease. Okay, thank you very much for your listening.